All right, so in this video, we are going to do goniometry and manual muscle testing for cervical flexion. So we're gonna start with goniometry. So cervical flexion happens in the sagittal plane. The end feel is firm. The normal value is 0 to 50. And as you can see, the standard position for the patient is sitting in a wooden chair, back fully supported, feet unsupported, feet and back supported. If the feet are not supported, you would put a little foam square or 2 or 3, however many is needed, underneath the feet to make sure that the feet are supported, but yours are, so we don't have to worry about that. So the instructions are, can you please look straight ahead, and can you please bring your chin to your chest? So we don't say, can you flex your cervical spine? We need to use layman's terminology. And then the fulcrum goes directly over the external auditory meatus, and the stationary arm is perpendicular to the floor. Perpendicular to the floor is up or down, but in this case, down would hit the patient's body, so we're gonna hold it up. Notice that my hand back here is resting on her shoulder, so my goniometer is nice and stable. Also notice that I'm not pressing this up against her head. And so my starting point is out here, because that's where her nose started. And then I bring this down and I line up this center black line along the moving arm to the base of her nares. All right, you can take a little break. And then I have 2 options. I can either read the red numbers because that's where the 0 is, so she's at 50, or I can do the black and do a little bit of math. So that was 50 degrees of cervical flexion. If she were to compensate, if she had limited cervical flexion, so do a little bit of cervical flexion, and she compensated by flexing the rest of her trunk, I'd give her verbal cues to keep her back up and maybe a tactile cue at the anterior shoulder just to help keep her trunk upright. Okay, and now we're gonna do MMT for cervical flexion, so I'm gonna have you lie on your back. So the standard patient position for cervical flexion is supine, and the therapist is gonna stand near the head of the bed to the side of the patient. And the cues are, I want you to lift your head up off of the table and bring your chin to your chest. And then that's at least a grade 3 right there if she went through her full available range of motion. I'm gonna try to push you back down. Don't let me do it, stay strong. Use 2 fingers for cervical flexion. And my other hand, if you can see this, the stabilization hand is not touching her, but it's back at the occiput in case she can't tolerate. So stay strong, stay strong. There's 4 and there's 5. Good, take a little break. I know that was a lot. If she could only bring her chin up toward her chest like halfway, but not full range against gravity, that would be a grade 2. And if I need to test for a 1 and a 0, I'm gonna palpate along her sternocleidomastoids, and I'm gonna palpate lightly because carotid arteries are here bringing oxygenated blood flow up to the brain, so it's very light. I would ask her to attempt the same motion. Can you bring your head up off the bed? If I see or feel anything, we call it a 1, and if I don't see or feel anything, we call it a 0.